COVID shut the world down, but COVID and cancer shut my world down.
When the world was first trying to figure out how to adapt during a global pandemic more than a year ago, an East Vancouver woman was navigating a cancer diagnosis.
Literally, the world collapsed around me as my own life collapsed around me.
Penny Acton was diagnosed with stage 3 breast cancer last February. She started chemotherapy on March 11th, 2020, the same day the World Health Organization declared COVID-19 a pandemic.
At the moment, I was like, what does that pandemic even mean? Like, what do you mean I'm getting chemo right now? How does that affect me moving forward?
At a time when many people were feeling isolated, Acton was undergoing chemotherapy, radiation, and multiple surgeries on her own.
It's basically almost a full-time job being a cancer patient, because you're going to appointments, you're going to treatments, and you're waiting, for the next appointment time. And my husband, unfortunately, wasn't able to go to any of the appointments with me because of COVID. So I basically was on my own.
And while others were socially distancing, Acton says her world was in its own bubble.
We were just so isolated in this little bubble, afraid of every germ that may walk through the door. So it was really scary and isolating and extremely stressful.
14 months later, she's recovered and has returned to her job as a social worker at a hospital in the Lower Mainland.
I had a really good response to the chemo, the surgery, and then pathology said that, things were gone. And they did, the radiation to make sure it was gone. And so, yeah, I think it's as close as to be as cancer-free.
It's an experience that's changed her perspective on life.
I have this constant joy and appreciation that I feel and I'm aware of. And I definitely never had that pre-COVID cancer.
Miranda Fatur, City News.